Hello again, everyone. My name is Paul Abdurrahman Isadona. Call me Parid, I respond to it. Our subject matter for today's program is emergency contraceptive. Since it is an emergency, we won't talk much. See you after this break. Hi viewers, welcome back from the break. As I said in the introduction, this is another interesting conversation, which I'm sure that by the time we are done with, all of us would have been educated on this very important subject matter. And it's the subject matter of emergency contraceptives. It sounds simple when you just say emergency, so it's two words, emergency and contraceptive. So maybe you are combining two words and you think it's a simple subject matter, but maybe there's more to it. And I'm sure that by the time we are done with today's program, you would have been educated on what emergency contraceptives are in the first place, how they are supposed to use, and whether you should even use them at all in the first place. As usual, I have my able panelists who will help us to dissect this subject matter into different dimensions. The first dimension is the layman's point of view, and in that regard, I'm delighted to have Madam Sarah Tete, a graduate of the University of Ghana, Legon, and a businesswoman who has a lot on her plate. Sarah, nice to see you.
Thank you very much.
How
nice
are you
to
doing?
see you too.
Yeah, I've not seen you in a while.
Yes,
You've been hiding.
ages.
Yeah. I'm happy to know you are doing well.
I'm good.
Yes. Are you looking forward to the conversation?
Yes.
Okay.
It's an interesting topic.
Yeah, I'm looking forward to your thoughts. And this is your first episode on this program since we started.
Yes.
What do you have to say?
I think so far it's a good program. It's very educative from what I've seen so far. I think we should continue here.
Okay.
We should put more in work to
Okay.
promote it. This is what I think Ghanaian audience need more. Yes.
And by then you are promising that you will come more often to
Yes,
to grace our
hopefully.
set. To grace our sets. Thank you for coming.
Thank you too for having me.
Yes, and we are honored again to have our regular in-house pharmacist, Farm Adams Akram. Farm, how are you?
Yes, I'm doing well.
Are you excited about the topic?
Yes, I'm excited.
It's like this topic elicits different reactions from men and women, but we'll come to that. I'm not sure. I'm not sure where your excitement is, but we'll come to that. But I'm happy to see you.
Yeah, it's good. It's good to be back.
Yes. And hopefully, as you've always done since we started, by the time you are done with the show, you would have broken down things to the barest minimum for our viewers.
We'll try our best. Yeah.
Our viewers to appreciate the subject matter and know what to expect when they go into the pharmacy to request for an emergency contraceptive. Sarah, what is an emergency contraceptive to you?
Okay, from research and a lot of hearsay, is mostly referred to as morning pill.
Okay.
Normally taken after maybe an unprotected sex.
Okay.
Yeah, so to prevent pregnancy.
Okay.
Yeah, that's what's.
That's what you.
Yes.
That's what your circles are talking about. Okay.
Yes, that's what we talk about.
That's good. That's good. Are we gleaning any other information on the streets, as it were, on emergency contraceptive?
No.
You've not yet.
Not yet.
Okay.
Yeah.
Okay. And I'm sure you have a lot of questions for
Yes,
the
a
man.
lot.
Okay.
A lot.
Good. If I ask him your first question.
Okay, my first question is, since they say it is a morning after pill, is it necessarily taken in the morning? Like maybe you have to wait till maybe later in the morning when you've had unprotected sex? Yes.
Not at all. I think that the general understanding, maybe in our setting, is sexual activities perhaps are had in the night, oftentimes. So you take it morning after. It may be just a term to mean that the morning after you do it, you take it. But really, it's the name in itself is emergency contraceptive, and so it's taken in sort of in case of emergency, and that has no time limit. Indeed, the earlier you take it, the better it is, even though they will tell you have a 72-hour window. But the earlier you take it, the higher your chances are. So there's even probability. I think the research shows that for every 8 women who take it at the right way they should take it, 7 out of those 8 women are higher probability, maybe 100% certain of going to get what it does. So it's not even 100% in that instance. Yeah.
Now, thank you for the answer, but let's go back a bit. What does it do? What do emergency contraceptives do?
Yeah, so I think the topic has been a strong issue, and I think sometimes the conversation gets mixed up. Okay, I hear emergency contraceptives, but again, what I hear is it's dangerous. They shouldn't take it. But the point is, when these drugs were introduced, originally they were meant for prescription. They were prescription-only medicines.
Yeah.
But as you know, in the foreign world, there's a high teenage pregnancy rate, and they're trying to control it. So within maybe half a decade of being introduced, they were quickly, if you like, declassified and became pharmacy only, or medications that the pharmacy could dispense to people in an attempt at trying to control the birth rate. I'm not sure birth control is exactly a topical issue in this part of the world. But be that as it may, we find it here. And so once there's demand for it, we have to ensure that anybody who needs to take it is taking it the right way, and they benefit from it as well.
Okay. Do you want to ask a question now,
Yeah,
Sarah?
I want to find out how exactly does it work? Like when you take it, how exactly are you expecting it to work?
So it's a hormonal treatment. Without going into the details, what it does is once you take it within the stated period and how you should take it, what it does, it alters some hormonal trigger that would, in the absence, natural progression would be to lead to fertilization and then pregnancy. So what it does is it will typically hold that hormonal activity until you cannot get to pregnancy or fertilization to pregnancy.
Yeah, thank you. Now, I mean, you and I have worked in the pharmacy, and we see how emergency contraceptives are used. So the word is emergency. What is emergency? Does that mean 2 times a week when you have unprotected sex, or 3 times a week?
No, so
or
really
every day?
so really the term emergency was to properly classify it. It was in instances where people are on long-term birth control, and for whatever reason they miss a number. You know, the long-term birth control, you are on the medication daily that controls your hormones. For whatever reasons, if you miss a day or 2, then you're at risk. And so if you have sex and you have missed a dose, you take it for within that period, just make sure that you are not pregnant. It's also for instances where during intercourse, the condom breaks for whatever reason, and there's chance that the woman may get pregnant. And so those that was the coinage. But typical as we are, we will find an emergency to make it fit. I can't tell you horrible experiences. Early on when I started my career, I was working very close to an educational institution. What we used to do was, so you get in the product maybe on a Wednesday. You get maybe a stock that should take you like a month or 2 months. You get in on Thursday, you stock up. Friday, you start seeing people coming. By Monday morning, you're down to 0.
Wow.
It was the #1 moving product. I formed the habit early on in the career of trying to engage people and get your contact. If you have an issue, you can text me. I received one call, it was probably around 10 p.m. Lady calls me, she just had a bout of sex and she's taking around 8 p.m. and she took one, and then around 9 or almost 10 there was another bout. So she's asking me if she can take a double dose.
Or the first one covers this one.
You know, and like that is completely off. You actually have people who come and say, okay, give me 5 packs of it. Why if it's an emergency, why would you want to buy 5 packs of?
For an emergency that has not yet happened.
Yes. So I mean, there are a lot of things out there, and I think that in discussing it, people need to understand it is an emergency, yes. It has a purpose, a role to play.
Yeah.
But it does not mean that it becomes routine. You cannot use it for routine contraception.
Okay.
And that is where the danger and the questions lie.
Yeah.
It's not routine contraception.
Okay.
If you want to do routine contraception, there are options in abundance that you can choose from.
Yeah.
And so at the pharmacy, we need to play that role, because I don't think anybody will go to a hospital or clinic to go and say, I want to see a doctor because I want an emergency contraceptive.
Yeah.
So it becomes the pharmacy, and we need to anchor, we need to drive that discussion and correct some of these wrongs.
Great. I'll come back to Sarah for you to tell me what you think that the pharmacy should do. Now, this is the topic is 2 ways. Okay, so farm has made it clear that it is an emergency contraceptive. So you only come for it when there's a real emergency, and he's listed what is considered as an emergency in this case. It is not an emergency if you have unprotected sex, one, maybe it was by accident, and you have another one, that cannot be an accident. Or even the first one cannot be an accident. That's not an emergency. You are aware of it, and then it happened. So that aspect is there. But also, when, for instance, Sarah, if you decide to go into the pharmacy and buy an emergency contraceptive, what should the pharmacy do to make you comfortable? What are you expected to be told? Do you get it? What are you expected not to be told? When we come back from the break, before Farm will talk about the unwanted effects, the harmful effects of abusing or misusing or overusing emergency contraceptives. We'll be right back, viewers. Hi viewers, welcome back to this episode once again. Interesting topic under discussion, emergency contraceptive. We've already put the subject matter into proper perspective, and that is emergency must be properly defined. It's an emergency contraceptive, and that is it. It's not a regular or a routine contraceptive. I was saying, Sarah, as a lady, are you comfortable walking into a pharmacy to go and buy an emergency contraceptive?
At a point, no.
Okay.
Yeah, but after some exposure, I gained that confidence.
Okay.
But at the time when I wasn't so confident about walking in to buy, I think what the pharmacy could have done to make it easier was to have a private space where you can talk to someone without the other person hearing what you wanted to buy.
Yeah.
Sometimes it's a bit intimidating. You enter into a pharmacy and there are like 3 or 4 people. So sometimes you just turn back and go.
And say,
Yes.
you can even decide that you want to buy charcoal. Because you know that there's no way you get charcoal there, and they'll say we don't have some, and you go.
Yes.
Yeah, so you think that they should create this space that will allow. Is this not something that should be easy for the pharmacy to do?
No, it's not even a question about being easy. It's as a pharmacy, you're trained to be professional. It's part of your training. And if you look at the literature around emergency contraception, that is one of the cardinal points. Because people are scared. People not scared, people are shy. People, it's not it's just something someone wants to openly talk about.
Yeah.
So the fact that they've walked into the pharmacy, I mean, initially, on your initial, the person would approach you, the person may not want to say it, but like I was saying, in every pharmacy, there should be a designated area that you can counsel patients.
Okay.
I mean, you should be able to tell.
Yeah.
I mean, if you are I remember when a couple of years back, I was in the pharmacy. I used to work early mornings on Saturdays, 8 a.m. I get to the pharmacy, we start work, and then as I was in the counseling room, and a lady walks in, and the first people she met were the MCAs.
Yeah.
So they try to get what she wants. I think she was not being open.
Yeah.
So one of them came to comment that there's somebody, a person may want to talk to me.
For the uninitiated,
Yes.
who is the MCA? So they met the MCAs who are there in the
Oh, they are medicine counter assistants. If you look at the hierarchy, you have the pharmacist, you may have a dispensing technician or technologist, and then you may have the last tier, the MCAs.
Okay.
They work in the pharmacy. They are not working alone. They're under the supervision of pharmacists. So where you have them, you should have a pharmacist supervising.
Good.
So they come to call me that this person may want to talk to me. I step out, and it's somebody I know.
Wow.
And like the person is lost. She can't even say the words.
Yeah.
Like she's caught in the like. She doesn't know what to say.
What to say?
Oh, so then I tell, oh, please come into the counseling room.
Yeah.
So I move her there. Then she's just there. She starts to laugh. I'm like,
Yeah.
what is it? She wants to bite something. I'm like, no problem.
Yeah.
So I go into the main pharmacy. I get it. I process it.
Yeah.
And I handle her in the counseling room. She
counseling.
picks her bag, concealed, and she leaves the pharmacy.
Yeah.
A pharmacy should have that.
Okay.
You should have a space where it's not just emergency contraception, but there are multiple incidences that someone may come. I'm not comfortable discussing my issue in the open. And as people who practice there, you should be smart enough to identify that for this, let me isolate this case and deal with it effectively. So you excuse the patient into a quiet area where there's privacy. And the patient is actually entitled to that, where there's privacy, so you discuss the issue and they can open up to you, and that helps you in terms of resolving what their issues are. So you're absolutely right, and I think that you can ask for that. Okay. If you get there and you are not comfortable, there's 4 people, there's how many people you're not comfortable, you may ask, can I speak to the pharmacist, or can I have a private conversation with somebody? Yeah. And then they are by their training, they are supposed to do that for you. So they move you into the counseling session. You can have your one-on-one discussion, and you'll be addressed discreetly, and you can move out.
But there's also the issue of the pharmacist, and I say pharmacist loosely, because what I mean is that the person behind the counter sometimes making off-cuff remarks, like somebody has said that she went to buy an emergency contraceptive and the pregnancy test kit, and the person said, you are going to write an examination and probably wish you good luck. You get so intimating that, okay, you've had sex, you are going to check whether you are pregnant or not. So the first one is to check whether you are not pregnant. Then you take them. Those off cuff, the pharmacist might think it's funny, or the person behind the counter thinks it's funny. There's
no way around it. That is strictly unprofessional, and you should not do that. Okay. I admit that there are instances for me myself. There are certain patients within the community that I've gotten accustomed to. So there are certain things I can say in jest, and they will understand that we have a certain relationship. But it's unprofessional to do that. I mean, this is somebody you don't know. It's very unprofessional, and I think that as a patient, you should be able to call it out. If he says that, I mean, this is unprofessional, I do not value it, and some people may actually insist on seeing the supervisor. I've worked in other pharmacies where they actually have suggestion boxes that you can actually put your comment in and indicate your displeasure about what happened. But I think that as a patient, you're able to call it out. I am not pleased with what you did. This is unprofessional. I don't think you should do that. And that person, if it's worth their salt, should be able to render an unqualified apology. And do what they're supposed to do. There's no way around it.
That point, well, that suffices for you, Sarah?
Yes.
It does. Okay. Now, quickly, take us through, despite all these things, despite the fact that sometimes it might be intimidating for a lady to go into the pharmacy to go and request for. But before that, I mean, emergency contraceptives for only women. In fact, let me say this, that I've had an encounter where a man came into the pharmacy furious. You are selling drugs in the pharmacy, it is not working. You people don't know what you are doing. Fought. Calm down. No, do you know what you've cost me? And then eventually he calmed down. What is the problem? My secure fast sell my uranium. I have to wait. I've taken secure. I've been buying secure here, and I've taken it. But my wife is pregnant, so he was buying secure, which is supposed to be for the woman, and he was the one who was taking it, and the woman got pregnant. So let me be clear. I emergency contraceptive for both men and women, or it's just for women?
I want to believe that was a one-off, and it was an exception.
That was a one-off, yes.
But I think that yeah. So maybe someone may come in and say, I want to buy what either is routine or emergency. Yeah. It is on you, the professional, to. In such instances, you may have to then ask further, who are you using it for? What is the purpose for which you are buying it? And so you can make an intervention there. Yeah. Perhaps he went and nobody cared. They just sold it to him, and this is what is happening. Yeah. But that is. And of course, when this also pointed as a weakness in the system I was working, because the fact that we all assumed that if the man is coming to buy secure, it's for his wife. So nobody ever asked him
We even thought he would feel offended if you asked him who is taking the secure. No, the man was the one who was taking the secure.
So just as like patients have rights, but they also have responsibilities.
Yeah.
So I'm behind the counter. Even though you may demand your right as to what has to be done, and I'm obliged to, if it is within scope, meet you halfway, you also have responsibilities. And I've worked in a very difficult environment where it was close to an educational institution. We're talking about professors of law and what have you. Someone walks in and says, hey, I want this drug. Then I ask, what is the purpose? Why are you taking it? The person gets furious. Can actually get verbally abusive. But you have to stand your ground. It's not a contest of words. I cannot give you this service because you haven't met this and that. The person makes noise, they walk away. Look, they will come back. And those were instances, and those are some of the there are some people like that I formed good relationships with, and it didn't start off as good. But I think that even for me as a pharmacist, and I get impressed, I've gone to pharmacies, I have colleagues there, not colleagues, they may not have known me. I say I want something, they're asking me all these questions. I say I'm a pharmacist, but they still insist that certain things have to be seen before they can address. And so while they're explaining, so if it becomes tough, I have to take an ID card and say, oh, I'm a pharmacist. Then they say, okay, you're a pharmacist. Okay, then I may not have to go into the detail of what you have to do. But believe me, if it is a prescription drug and you don't have it, the pharmacist will not give it to you. They will not give you the product. And so the professionalism is there. And so we expect that behind the pharmacy, number one, you should be able to handle these cases. Emergency contraception is a very sensitive area. When you look at it, anytime it's being discussed, there's also the arm about people don't want to open up. They are scared or they are shy to talk about it. And so we have to create the avenue. There's also room to work with other people. I also worked in a pharmacy where there was a hospital close by. And within the hospital, they have a family planning unit. The head of the unit came to the pharmacy and says, people are not coming to her. She wants to help, and she's seen people come for abortions, young students. So she came to me and we said, you know what, let's do something. So we started to do a data. Anybody who comes in to take, I'm not, it's anonymous, I'm not taking, but once you come in and we look at the trajectory. So if there was a case, somebody walks in and says, oh, I'm pregnant for any reason, I want to do this, and it's beyond me, what I do is I give her a call. She accepts the person and is able to handle it and provide the best of care. It is better than allowing the person, if I say I won't do it, the person goes to the next pharmacy, an unscrupulous person sells it to the person, and then by the time they get to her, it is a
interesting point.
Case,
In wrapping up, what are the harmful effects, and it's definitely harmful effects, of abusing or misusing emergency contraceptives?
Well, it's an abuse, and the effects of that may vary between people, but typically the drug works by working on hormones. The hormones behave in a certain way, and it is a one-off. It is not intended to be routine. The moment you convert it into a routine contraception, then you are forcing the body to react a certain way, and there are hormones. Ladies, sometimes you may have your calendar that you calculate that my menses should come at a certain time. The hormones may, at some months, be overactive. It may come earlier, it may come later. Your cycle may completely get jammed up. Sometimes we even have to use medication to correct it. It's similar. So once you use drugs and you continually use it for something that shouldn't be prolonged, it's sort of tuning the system in a certain way, and what you have is your menstrual cycle gets messed up. Ovulation issues. I mean, these are not well documented, but there are reports of people having ovulation, issues of ovulation, and in turn, childbirth. And so there are things that we have to put in place to ensure that the person's system can come back to what it normally should be before they can conceive. So these are very grave. And as any drug, the side effects are clear. Once you use it the wrong way, depending on who is taking it, you can imagine what can happen.
Sarah, in wrapping up, what do you have to say about the subject matter now that we've gone through this whole process of breaking it down?
I think everything so far has been made clear, but I have a question. There's this issue about traditional contraceptive, and I've heard of the neem tree. I don't know how safe or how unsafe that is. If you could touch on those herbal contraceptives.
Yeah, so the issue of herbal medicine is sometimes complicated because herbal medicine has place in medicine. There are herbal medicines that are licensed by the Food and Drugs Authority. And so if you take neem leaves, and the main reason is that when you get a plant, there are a lot of things inside the plant. There may be one thing that is doing the actual work. There may be other things that may be toxic or poisonous. And so what then happens is once they distill it and they do a preparation, they're able to extract what actually does the work with less side effects. So the FDA will then do a test, verify before they put a label, and it's on the open market. Even that, they still do routine surveillance on the market to see if it is not having any side effects. So independently, if you go take a product and then you distill and say it's for, it can do abortion, nobody can verify that. Once something goes wrong, I cannot verify that. Nobody can verify that. I mean, you have yourself to blame because I don't know what is in there. It has not been properly distilled. There are stories of where growing up, I'm told people grind, they'll break a bottle, grind it into fine powder, mix it with some alcohol or some drink and take it, and it's supposed to expel. I mean, those are things that I cannot talk about it because I don't know what you are taking. It's neem, but neem alone does not. How you extract it? Are you using alcohol? Are you using water? What is inside there plus what can actually do the work you want? Has the Food and Drugs Authority looked at it? And so there are issues there that we cannot control. And so if you want to do herbal and there's a herbal option out there, be sure that that herbal has been properly licensed by the Food and Drugs Authority, and then you can be rest assured that it's safe. If it's not, don't take it.
Thank you very much. Thank you. Sarah, thank you for coming. It's a delight to have you. You added color and insight into the conversation. Fam, thank you for, as usual,
thank you.
An insightful
Thank you for having
conversation and insightful education on the subject matter. Viewers, I'm hopeful that you've all learned something, and from now on, the usage of emergency contraceptive will be used as such. And even if you have to, you'll be minded to speak to the